Well, Rob, thank you very much for inviting me, and it's really lovely to be part of this week. CO Awareness Week itself it's been going for a long time, but it is hugely important. And I really feel that it enables all those who want to prevent deaths or life-changing illnesses and poor health that we see associated with CO exposure to actually come together and spread awareness and information about CO and provide actions that people can take, which is really important. And it will hopefully prevent CO from affecting people's health or the health of family and friends. So to me, that's why it really is such a great focus. But for the COMED group, the CO medical subgroup, I think we also see it as something that underpins much of the work that the organisations and groups and individuals undertake throughout the year to prevent CO exposure and also diagnose CO exposure, particularly for the medical professionals, and treat CO exposure. The work that we look at might be anything from scientific and medical research to the sort of behavioural research and understanding the technological improvements or developing age-appropriate materials. So, this is all very, very important information that we all put together to try and bring some sort of cohesiveness to what is actually a really diverse week in terms of how we are going to try and prevent carbon monoxide exposure.
Yeah, and I guess that's where I think the research and the medical side of it is so key, is that, I mean, obviously I've worked from a communication side in terms of getting the message out to the people, but everything from me in a communication setting, full stop, needs to be sort of data driven and based on fact. It can't be based on assumptions. And equally, you discover ways of new messages that I need and the APPCOG conscript need to get out there, because you're identifying new problems, new people that have heightened risks, and we need to make sure that those messages are captured. I think that's where in terms of in the APPCOG community, why that's so important. One really should lead the other. I feel the comms side should always be driven by the data and the research and the facts, because the overarching comms message remains roughly the same, but there's nuances and differences. And obviously, as we know, this week we're focusing more on sort of lower levels of carbon monoxide and how that affects people, and that's very much part of the research that you're doing.
Yes, it is. What we've seen are the people who are dying from carbon monoxide poisoning is reducing, but we're seeing this sort of insidious nature of lower level and this sort of long-term exposure that is causing problems. And CO isn't simple. It's not there isn't, as you said, with the communications, it's using those nuances and the new elements that we find. And to start with, it's really important to be able to diagnose CO exposure. Its symptoms range from headache, dizziness, nausea, sort of flu-like symptoms, but all the way through to collapse and coma, where it's a little bit more understandable. But these lower, these more mild symptoms, and those that can sort of trick the healthcare professional into thinking that the cause of these symptoms is something else, is the bit that we find hard within COMED. And you can really easily attribute these symptoms to other illnesses, and so therefore making an accurate diagnosis and therefore providing the right treatment is important. And we see, in winter, for example, the symptoms of CO poisoning can be mistaken for flu or a very bad cold. We were just saying,
both of us have had something similar, haven't we?
Absolutely, just earlier.
And I've been doing, lateral flows all the time, thinking, is it COVID? Is it COVID? But I mean, I'm fortunate that I understand CO, and I've got lots of carbon monoxide alarms in my house.
Yeah.
But to someone who hasn't and doesn't understand, they could be doing lateral flows every day and thinking, oh no, it's just a cold. No, I've just got the flu. But I've had ongoing flu type thing for probably 2 weeks, but I know it's not CO poisoning because I'm fortunate that I have all the protection. I understand it. To many people, they can be living with and I'm very aware. Absolutely. And that's really key, that this week, with the CO Awareness Week, there could be people that have had assumed it's a heavy cold or the flu, and the only alternative in their mind is COVID, because that's all we see and hear. It could really be something else.
Yeah, and that's the other thing, is that when you're going to then take action, because you've got your cold or your flu, or that's what you think it is, you stay at home, or you rest. You have to keep warm, and this could mean actually you turn up the heating, and if your symptoms are due to CO, that's when levels can creep up and potentially become fatal. You don't want to be taking what you think is a correct course of action when in fact it really isn't.
I think what's interesting is I'm having some building work on my house at the moment, and we'll have a period where there'll be no radiators in that area of the house, and I wouldn't have expected our builder to know, but he said sort of off the cuff, well, you might have to use you can use your gas hob to keep you warm, and I then said, well, absolutely not. And again, it's just no reason why he should have known. But that's a job that we need to do in terms of the behaviours. And he was saying it off the cuff as a joke, but someone that didn't understand, it could have been quite a dangerous piece of advice. Yeah. So, but that's where I think, and these behaviours are quite key as part of this week, talking about not only how to stay safe, but the dangerous behaviours people need to try and avoid.
It's very easy to get lulled into this sense of security when you behave in a certain way and you've always done it and nothing adverse has happened. There's been no problem with your action, and to some degree you feel that it's helped you in some way. And it's actually, changing that through awareness and through simple messages, or understanding that actually it's not a sensible thing to do, that is very important with Carbon Monoxide Awareness Week. I always wonder, when you look at your boiler, do you actually think about what it looked like when it was brand new? Or are you just accepting that it looks old and has sooty stains around it, which actually are signs that it's not working properly? That gas hob has always had a lazy yellow flame, but we use it because it's fine. But is it fine? You just assume, and it's very easy to get lulled into that. The daily life, things carry on in what seems like normal, and it isn't that at all. It's there is something else that's happening, and actually it is the cause of your headache. It is the cause of you feeling tired all the time, rather than it being your everyday pressures on life.
Yeah, absolutely. I think this year especially, these guidance is so important because of you only have to look in the press in terms of inflation and prices and gas prices and companies going out of business and so many things. That the pressures on people financially this year are greater. So a message from us of service your appliances and buy a carbon monoxide alarm, although they are still the two best ways to stay safe, they may not be accessible to some. So other ways of staying safe is really key.
It is, and also understanding where to get help, because there are schemes out there that will understand if you are in some financial difficulty, or there is some barrier that is preventing you from being able to have your appliances serviced, or to be able to get a carbon monoxide alarm. There are services out there that will help you, and I think that providing direction as to where people can get help will all contribute to being able to stay safe in your home this winter.
Yeah, but make sure to include all the links to various places and the gas services numbers and all those things, so everyone has access to all of those. One of the pieces this year we're using is obviously the acronym COMED, which I think is quite important for people this year.
Yes.
Obviously C being cohabitee, so are other people you live with feeling the same, which is obviously a guide. O for outdoors, so do you feel better when you go outside, which is obviously again a sign that the issue is within your home. M is obviously maintenance, so have you been maintaining your appliances? Have they been serviced recently? And then A being the alarm side, so if there is an alarm in the property, has it been going off? I think they're again useful to diagnose something otherwise that could be assumed as the flu again.
Yes, and they are useful not just for the general public, but also for medical professionals. And this is where COMED has really been trying to back work into this and to really spread the message that medical professionals need to think carbon monoxide. It can be really easily ruled out, but actually just by thinking of that very simple COMA acronym and asking your patient these questions, that will help to increase suspicion as to whether there might be an association with carbon monoxide. And then they can then take tests. They can take blood tests, they can take exhaled breath tests, and interpret the results and make a decision. But what is really vitally important is that, and actually very scary, is the thought that if a diagnosis is missed and the patient is treated as the doctor really expected, it to be from their symptoms to be caused by something else, and have treated them appropriately, but then sent them home. And if that home is the place where exposure has occurred, then that exposure is going to continue, and those symptoms are either going to continue or get worse. It isn't going to get better without some sort of intervention from a registered and trained engineer.
Yeah, no, absolutely. That's always been one of the things I've focused on a lot in terms of that. I think the medical professional could very simply and very easily send them straightly back to the cause of the problem, and that's particularly scary. So there's this is, as an awareness campaign, isn't just for the general public; it's for everybody to have that insights and knowledge. And I've done pieces of research, different sort of types of research in terms of finding out sort of the poisoning numbers and the like. And it's incredible how many NHS trusts don't even have carbon monoxide as something to record a reason for. It's just poisoning as in general, so it could be easily missed as an opportunity for food poisoning. It could be any type of poisoning. So I think there's definitely a bigger job to do there.
There is a lot of work to do there, and we've been really pleased within COMED for some of the work that has actually just recently been completed in a few hospitals in the south, and we are hoping that this is going to really provide a launch pad for further work and greater awareness amongst the healthcare community. So that is a really positive. Yes.
Oh, that's really, really good news.
Yeah.
Okay, so one thing I think that's really useful to hear. What would your sort of advice would be for anybody going into Carbon Monoxide Awareness Week? We've got also messages for anybody that's listening and hasn't been aware of carbon monoxide, is starting to learn. Okay, this is something I need to be aware of. What would the best sort of piece of advice for them be?
Gosh, of course, there's a lot of advice that one could give, but I think that understanding that carbon monoxide is not necessarily something that is rare and won't happen to them. Carbon monoxide is produced from a malfunctioning appliance. Anything that burns fuel will produce carbon monoxide, and it's just how it's functioning that depends on the levels. So whether there's a catastrophic event and you're exposed to a lot of carbon monoxide in a very short space of time, that can be fatal, and that is frightening because you won't know that you're being poisoned. So for those sorts of incidences, you want to protect yourself, and you should for those instances get an alarm, because that will warn you of when there are levels that are dangerous to health. But then talking about the lower level exposure, we know within the COMED group that exposure to lower levels of carbon monoxide over a longer period of time also affects your health, and it affects the brain, it affects the heart. So people will have problems with their memory or attention. They could have issues with coordination, depression, and all these sort of subtle personality changes that you wouldn't necessarily realize is coming from carbon monoxide. Those who've got cardiovascular disease, that'll affect the way their heart is functioning, and actually this low level of carbon monoxide may be sort of having an effect on their disease, and you want to make sure that you're not causing your health to worsen because of carbon monoxide, and likewise those with young children, they are also very vulnerable to lower levels of carbon monoxide. So in those instances, it's really important that you get your appliances serviced and actually prevent exposure from the appliances at this low level, which could actually have an effect on your livelihood, have an effect on how your children work in school, how you are operating in work yourself, and your livelihood therefore could be at stake. So it is really important to make sure that you're not exposed to lower levels of carbon monoxide, but also obviously that levels that cause death are not found in your home at all, and that is stamped out.
Yeah, absolutely. I suppose one element that people probably wouldn't even consider, again, in terms of the importance of the alarm side of things, that there has been incidences where tragically the CO's passed through, brickwork and alike, and has killed people in neighbouring properties. So
Yes.
you could have serviced your appliances daily. You could be the most CO aware person in the world, but without a CO alarm,
Yep.
a carbon monoxide alarm, that is another real possibility.
That is the problem with carbon monoxide, is that there are so many different ways in which it can affect you. It depends on your circumstance. It depends on whether you're living in a flat. Are you living in a flat and somebody below you has a faulty appliance, or someone to the side of you has a faulty appliance? And likewise, if you're in a house, do you actually have a carbon monoxide alarm in all the areas that require one? Even rooms that have chimneys running through them, if that chimney is cracked, then the carbon monoxide will seep out, perhaps into an upstairs room, and cause that exposure and that poisoning. So you have to be very aware that it's not just the behaviours; it's how your house, for example, is situated, and therefore what dangers there are that you could be exposed to from perhaps neighbours, or maybe a business that works below you, and that sort of thing as well.
Yeah, I think it's a really great point to maybe end on there. It's such an unknown. Obviously, being the silent killer, you can't see, smell, or taste it. It's very important people understand the symptoms. They understand behaviours that can minimise the chances of it being in your property. But then obviously the ways of alerting you and others with that carbon monoxide alarm, which is always going to be the best way to be warned of carbon monoxide in your home. So yeah, I think it's important this week that we get the message out there further. Thank you for all the work you do in the COMED group to keep layering on the data and the insight and the academia that's critical to make sure we're identifying where the real problems are, and we can, as a group, hopefully every year, get those messages out even further.
That's super. Rob, thank you very much. It's been a great pleasure, and I wish you all the success with communicating the messages for this Carbon Monoxide Awareness Week. Thank you
very much. Thank you.